If you are over 60, your blood pressure may be changing in ways you cannot feel, and that is exactly why this matters so much. Many people think they would know if something was wrong. They think high blood pressure would cause pain, pressure, or a big warning sign. But very often, it does not. You can feel normal and still have numbers that are slowly putting stress on your heart, your brain, your kidneys, and even your balance. And here is the part that worries so many families. After 60, blood pressure does not always go in just one direction. For some people, it climbs too high. For others, it drops at the wrong time, especially when they stand up. That can lead to dizziness, falls, and scary moments that seem to come out of nowhere. So in this video, I want to help you understand what really happens to your blood pressure after 60, what many people miss, and what simple steps can help you feel safer and more in control. Let's start with the change that happens most often. As we age, our blood vessels become less flexible. You can think of them like a garden hose that slowly gets stiffer over time. When that happens, the heart has to push harder to move blood through the body. This often makes the top number in your blood pressure reading go up. That top number is called the systolic number. It is the pressure when your heart squeezes. This is one reason high blood pressure becomes more common with age. And it is also why many older adults have a pattern where the top number is high, but the bottom number is still normal or even low. A lot of people see that and say, well, only one number is high, so maybe it is not serious. But it still matters. That pattern can raise the risk of stroke, heart disease, kidney trouble, and memory problems over time. Now here is what catches many people off guard. High blood pressure often has no clear symptoms at all. No warning bell. No pain. No signal that says, please check me today. That is why so many people are shocked when they get a high reading at a clinic, pharmacy, or home monitor. They say, but I feel fine. And I understand that. Feeling fine is comforting. But blood pressure is one of those health issues where how you feel and what the numbers show can be very different. That is why regular checks after 60 are so important. Not to make you anxious, but to give you a chance to act early, while small changes can still make a big difference. But there is another side to this story, and it deserves just as much attention. Some older adults do not mainly struggle with pressure that stays too high. Instead, they have moments when blood pressure drops too much, too fast, or at the wrong time. This often happens when standing up after sitting or lying down. You may have felt this before. You stand up and suddenly feel lightheaded. Your vision blurs for a second. You feel weak, unsteady, or like you need to grab the wall. Some people call it just getting older. Some brush it off and keep walking. But that can be risky. When blood pressure drops on standing, it can increase the chance of falling, and falls can change a life in a moment. If this is already making you think about your own blood pressure, or someone you love, tell me in the comments how old you are and whether you deal more with high numbers, dizziness, or both. And if you want more simple, caring health videos made for older adults and caregivers, subscribe and stay with me. My goal is to make this channel feel like a safe place where health information is clear, calm, and useful in real life. So why does blood pressure get more complicated after 60? Because the body changes in more than one way at the same time. Blood vessels may stiffen. The heart may respond more slowly. The nerves that help control pressure can become less sharp. You may be taking more medicines than you did in your 40s or 50s. You may drink less water because you do not want to be up all night using the bathroom. You may be sleeping less deeply. You may be less active because of joint pain, back pain, or fatigue. And all of these things can affect blood pressure. That is why blood pressure after 60 is not just about one number. It is part of a bigger picture. Here is something important to remember. One blood pressure reading is just a snapshot. It tells you what was happening in that moment. It does not tell the whole story. Maybe you rushed to sit down. Maybe you were upset. Maybe you just had coffee. Maybe you were talking during the reading. Maybe the cuff was too small. So instead of reacting to one number with panic, think in terms of patterns. What are your readings like over several days or weeks? Are they high in the morning? Do you feel dizzy after meals? Do you feel weak after taking your medicine? Do you get headaches when your numbers run high? Do you feel unsteady when you get out of bed? These patterns are often more useful than one reading by itself. That brings me to home blood pressure monitoring, because when it is done correctly, it can be one of the most helpful tools you have. But when it is done the wrong way, it can also create a lot of confusion. So let's make it simple. If you check your blood pressure at home, sit quietly for about 5 minutes first. Keep your feet flat on the floor. Rest your back. Support your arm so the cuff is at heart level. Use a cuff on the upper arm, not your finger, and be careful with wrist monitors, because they can be less reliable. Do not check it over a sleeve. Do not talk while the machine is working. And if possible, take 2 readings about a minute apart and write them down. That little bit of care can make the numbers much more useful. Now here is the part many people miss. Sometimes the reading is not wrong because of your body. Sometimes it is wrong because of the setup. If the cuff is too small, the reading can look higher than it really is. If you are sitting with crossed legs, it can change the number. If you just walked in from outside and checked it right away, the number may look different than it would after resting. So if your blood pressure seems all over the place, do not assume the worst. First, make sure your method is solid. Bring your monitor to your next appointment and ask your doctor or nurse to compare it with their equipment. That one step can clear up a lot. Let's talk about common signs that something may need attention, even if you are not sure it is blood pressure related. Feeling dizzy when standing is one. Feeling faint in the shower is another. Blurry vision for a moment when you rise from bed matters too. So does unusual fatigue, feeling weak after meals, or having a strange pounding headache with higher readings. Swollen legs, shortness of breath, chest pressure, confusion, or sudden trouble walking should never be brushed aside. Not every symptom means a blood pressure emergency, but symptoms do matter, and they are worth paying attention to. Now I want to talk about one of the biggest hidden causes of blood pressure problems after 60, and that is dehydration. It sounds simple, almost too simple, but it is a very common issue. Some older adults stop drinking enough because they worry about bladder leaks or frequent bathroom trips. Some lose fluids during hot weather. Some get dehydrated during a stomach bug, after sweating, or even just because they do not feel thirsty. When the body does not have enough fluid, blood pressure can drop. You may feel tired, dizzy, foggy, or weak. So if you often feel lightheaded, especially in the morning or when standing up, ask yourself if you may be drinking less than your body needs. If you have heart failure, kidney disease, or a fluid restriction, do not change your fluids on your own. Ask your doctor what amount is right for you. And then we have food. Many people know salt can affect blood pressure, but the tricky part is that most salt does not come from the salt shaker. It often hides in canned soups, packaged noodles, frozen meals, deli meat, sauces, chips, crackers, and restaurant food. A meal can seem normal and still be packed with sodium. That extra sodium can make the body hold on to more fluid, which may push blood pressure higher. On the other hand, skipping meals or going too long without eating can make some people feel shaky or weak, especially if they have diabetes or take certain medicines. So the goal is not perfection. The goal is steadiness. More real food. More meals you recognize. Less heavily packaged food when you can manage it. Now this is important. Sleep can affect blood pressure more than many people realize. If you snore loudly, wake up gasping, wake often through the night, or feel tired even after a full night in bed, that matters. Poor sleep can make blood pressure harder to control. It can also affect mood, memory, balance, and energy. Many older adults think being tired all day is just part of getting older, but sometimes it is a clue that something else is going on. If your blood pressure is hard to manage and your sleep is poor, that is a very good conversation to have with your doctor. Let's also talk about stress, because people often hear that word and tune out. They think, well, of course stress is bad. But what does that actually mean in daily life? It means rushing. It means poor sleep. It means eating whatever is easiest. It means feeling on edge all day. It means your body never really settles. Stress alone may not explain every blood pressure problem, but it can definitely make things harder. You do not need a perfect life to help your blood pressure. Sometimes very small things help. Slower breathing for 2 minutes. Sitting in the sunlight. A short walk. Quiet prayer. Gentle stretching. Calling a friend. Reducing that constant feeling of pressure in the body can help more than people expect. And now we need to talk about medicine, because this is where many people feel confused. Some medicines protect you and help control blood pressure in a very important way. Others can raise blood pressure or make you dizzy. Some pain relievers can push blood pressure up in certain people. Some cold and flu medicines, especially decongestants, can do the same. At the same time, blood pressure medicines, water pills, heart medicines, and some drugs for mood, sleep, or prostate symptoms can sometimes make pressure drop too much, especially when standing. That does not mean the medicine is bad. It means the whole list needs to be reviewed carefully. Please do not stop a prescription medicine suddenly on your own. But do bring every pill, vitamin, herb, and over-the-counter product you use to your doctor or pharmacist and ask, could any of these be affecting my blood pressure, my dizziness, or my risk of falling? That is a smart question. Here is another hidden issue. Blood pressure and kidney health are closely connected. Your kidneys help manage fluid and pressure in the body. High blood pressure can damage the small blood vessels in the kidneys over time. Then the kidneys may not work as well, and that can make blood pressure even harder to control. It becomes a cycle. That is why blood pressure after 60 is not just about the heart. It is also about protecting the kidneys. If you have high blood pressure, ask if your kidney numbers and urine tests are up to date. Simple lab work can reveal problems early, before you feel them. I also want to mention the brain, because many people are not told this clearly enough. Healthy blood pressure helps protect healthy thinking. Blood pressure that stays too high for too long can raise the risk of stroke and can affect brain health over time. But blood pressure that drops too low in the wrong moments can also make a person feel foggy, weak, or unsteady. So the goal is not just lower at any cost. The goal is safe, steady, well-managed blood pressure that fits your whole health picture. That is why your treatment plan should be personal. Age matters. Symptoms matter. Medical history matters. How you feel when you stand matters. Here is a very practical habit that can help more than most people expect. Keep a simple blood pressure and symptom journal for 1 or 2 weeks. Nothing fancy. Just the time, the reading, and how you felt. You might write, 8 a.m. before breakfast, 148/82, felt okay. Or 1 p.m. after lunch, felt sleepy and dizzy when standing. Or 9 p.m. After medicine, 112/64, a little lightheaded. That kind of record can help your doctor see patterns much faster. It can show whether numbers run high in the morning, drop after meals, or swing after certain medicines. This is one of the easiest ways to turn confusion into useful information. And here is the one insight I really want you to stay for, because many people never think to do this. If dizziness is one of your main symptoms, ask your doctor if your blood pressure should be checked both sitting and standing. Some problems only show up when position changes. A reading taken while you are sitting quietly may look acceptable, but the moment you stand, the pressure may fall and symptoms begin. This is especially important if you have had a fall, nearly fainted, or feel shaky when you first get out of bed. That one detail can open the door to better answers. Of course, there are times when you should not wait to see what happens. If you have very high blood pressure and also chest pain, shortness of breath, severe back pain, sudden weakness, numbness, trouble speaking, sudden vision changes, severe confusion, or a sudden severe headache, get emergency help right away. If one side of the face droops, one arm feels weak, or speech suddenly sounds strange, treat that like a stroke warning sign and call emergency services immediately. And if you faint, that needs prompt medical attention too. Most blood pressure concerns are handled calmly and carefully, but knowing the red flags can protect your life. So what happens to your blood pressure after 60? For many people, the top number rises because arteries become stiffer. For some, blood pressure stays high with no clear symptoms, which is why routine checks matter so much. For others, blood pressure may drop at the wrong time, especially when standing, leading to dizziness and falls. Medicines, sleep, hydration, food, stress, kidney health, and other conditions all play a role. The good news is that you are not powerless in this. Small, steady habits can help. Careful tracking can help. Good questions can help. The right treatment plan can help. And maybe most important of all, you do not have to figure this out by fear. You can figure it out by paying attention. Notice your pattern. Notice how you feel when you wake up, after meals, after medicine, and when you stand. Notice whether your home readings make sense or need to be double-checked. Notice whether salt, sleep, or stress may be playing a part. Then bring that information to your healthcare professional and work as a team. That is how people stay safer, steadier, and more confident. If there is one next step I want you to take after this video, it is this. Start a simple record of your numbers and your symptoms for the next few days. Not because I want you to obsess over it. Because I want you to understand your body a little better. And if this video helped you, please share it with a parent, a spouse, a friend, or a caregiver who may be worried about blood pressure after 60. And tell me in the comments what you want me to talk about next. Maybe dizziness, kidney health, morning blood pressure, sleep, or the safest questions to ask about medication. I would love to make the next video for you.